Everything you need to know about kidney failure. If your kidney function drops below 15% of normal, you are said to have kidney failure. You may have symptoms from the buildup of waste products and extra water in your body. To replace your lost kidney function, you may have one of three treatment options: hemodialysis, peritoneal dialysis, kidney transplant. End-stage renal disease, ESRD, is kidney failure that is treated by dialysis or kidney transplant. Some people with kidney failure choose not to have dialysis or a transplant but continue to receive care from their healthcare team, take medicines, and monitor their diet and lifestyle choices. Work with your healthcare team and family to consider your options and choose a treatment that's right for you. Treatment will help you feel better and live longer. The more you know ahead of time about what to expect, the better prepared you may be to make a treatment choice and take charge of your care. You also need to give yourself time to get used to the big changes that will be happening in your life. Kidney failure will change your day-to-day activities and may change your relationships with friends and family, and how you feel. What are the symptoms of kidney failure? Symptoms of kidney failure may begin so slowly that you don't notice them right away. Healthy kidneys prevent the buildup of wastes and extra fluid in your body and balance the salts and minerals in your blood, such as calcium, phosphorus, sodium, and potassium. Your kidneys also make hormones that help control blood pressure, make red blood cells, and keep your bones strong. Kidney failure means your kidneys no longer work well enough to do these jobs and, as a result, other health problems develop. As your kidney function goes down, you may have swelling, usually in your legs, feet, or ankles. Get headaches. Feel itchy. Feel tired during the day and have sleep problems at night. Feel sick to your stomach, lose your sense of taste, not feel hungry, or lose weight. Make little or no urine. Have muscle cramps, weakness, or numbness. Have pain, stiffness, or fluid in your joints. Feel confused. Have trouble focusing, or have memory problems. Following your treatment plan can help you avoid or address most of these symptoms. Your treatment plan may include regular dialysis treatments or a kidney transplant, a special eating plan, physical activity, and medicines. How can I live well with kidney failure? Doing well with kidney failure is a challenge. You will feel better if you stick to your treatment schedule. Review your medicines with your healthcare provider at every visit and take your medicines as prescribed. Work with a dietitian to develop an eating plan that includes foods you enjoy eating while also helping your health. Stay active. Take a walk or do some other physical activity that you enjoy. Stay in touch with your friends and family. Treatment with dialysis or transplant will help you feel better and live longer. Your healthcare team will work with you to create a treatment plan to address any health problems you have. Your treatment will include steps you can take to maintain your quality of life and activity level. Your eating plan plays an important role. When you have kidney failure, what you eat and drink may help you maintain a healthy balance of salts, minerals, and fluids in your body. Can I be active with kidney failure? Yes. Physical activity is an important part of staying healthy when you have kidney failure. Being active makes your muscles, bones, and heart stronger. Physical activity also makes your blood travel through your body faster so your body gets more oxygen. Your body needs oxygen to use the energy from food. You may find that physical activity can also improve your mood and make you feel better. Talk with your doctor before you start a new exercise routine. Start slowly, with easier activities such as walking at a normal pace or gardening. Work up to harder activities such as walking briskly. Aim to be active on as many days as possible. Will kidney failure affect my sleep? People who have kidney failure may have trouble sleeping. Sleep loss can affect your quality of life, energy level, and mood. Restless leg syndrome, sleep apnea, pain, or itching may make it hard for you to sleep. You can take a number of steps to improve your sleep habits. For example, physical activity during the day and a warm bath before bed may help you sleep better at night. Avoid caffeine after lunchtime. Avoid alcoholic drinks before bed. Avoid smoking. Talk with your healthcare provider if you often feel sleepy during the day or have trouble sleeping at night. Healthcare providers can treat sleep disorders such as sleep apnea or restless leg syndrome. Will kidney failure affect my sex life? Kidney failure will affect your emotions, nerves, hormones, and energy levels, all of which may change your sexual relationships. Taking good care of yourself by managing your kidney disease and controlling your blood pressure and blood glucose levels can help prevent some sexual problems, such as erectile dysfunction. Getting counseling may help with some emotional problems, such as anxiety and depression, which can get in the way of having satisfying sex. You may feel shy asking questions about your sex life, but your healthcare team has heard the same questions from other people. Your provider is trained to help you address concerns about your sex life. Can I keep working with kidney failure? Many people with kidney failure continue to work. Kidney Works is a program to help people with kidney disease keep working. The program focuses on Americans with CKD whose kidneys have not yet failed or who are living with a transplant. If you are on dialysis, the information in the Kidney Works paper may also provide tips to help you keep your job. The Americans with Disabilities Act means that an employer can't legally fire you just because you're on dialysis or have had a kidney transplant. The law requires an employer to make reasonable changes to the workplace for a person with a disability. For example, your employer may give you lighter physical jobs or schedule your work hours around your dialysis sessions. If you're on peritoneal dialysis, you'll need space and time to change the dialysis solution in the middle of the workday. Most employers can make these adjustments. If your employer isn't willing to meet your needs, your dialysis clinic's renal social worker may be able to help find a way to satisfy both you and your employer. How will kidney failure affect how I feel about my life? Coping with kidney failure can be stressful. Some of the steps that you are taking to manage your kidney disease are also healthy ways to cope with stress. For example, physical activity and sleep help reduce stress. Learn more about healthy ways to cope with stress. Depression is common among people with a chronic or long-term illness. Depression can make it harder to manage your kidney disease. Ask for help if you feel down. Your healthcare team can help you. Talking with a support group, clergy member, friend, or family member who'll listen to your feelings may help. Treatment for depression is available. Choosing a treatment for kidney failure as your kidney disease gets worse, your health care provider may talk with you about preparing for kidney failure. Talking early with your provider about your treatment options, and making a choice before you need any one of these treatments, helps you take charge of your care. Treatment will help you feel better and live longer. Understanding the treatment you choose and getting used to the idea that you need this treatment takes time. Each type of treatment has pros and cons. Your choice of treatment will have a big effect in your daily life. By learning about the differences among treatment options, you can choose the one that will be best for you. The more you know about the types of treatment, the better prepared you may be to make a choice. How soon should I start learning about what type of treatment to have? Start learning early about treatment options, before you need one. You'll have time to learn about the different treatment options. Talk with other people who are living with dialysis, a transplant, or conservative management. Share your thoughts with your family and loved ones so they can learn about your treatment choices, too. Work with your healthcare team to create a kidney failure treatment plan. Prepare yourself mentally and physically for the changes ahead. Creating a treatment plan and sharing it with your family gives you more control. What are my treatment options for kidney failure? You can choose one of 3 treatment options to filter your blood and take over a small part of the work your damaged kidneys can no longer do. A 4th option offers care without replacing the work of the kidneys. None of these treatments will help your kidneys get better. However, they all can help you feel better. Hemodialysis uses a machine to move your blood through a filter outside your body, removing wastes. Peritoneal dialysis uses the linen G of your belly to filter your blood inside your body, removing wastes. Kidney transplant is surgery to place a healthy kidney from a person who has just died, or from a living person, into your body to filter your blood. Conservative management treats kidney failure without dialysis or a transplant. You'll work with your healthcare team to manage symptoms and preserve your kidney function and quality of life as long as possible. Doing well with kidney failure is a challenge, and it works best if you stick to your treatment schedule. Review your medicines with your healthcare provider at every visit. You are the only one who knows how your body is responding to each of your medicines. It's really important that your provider knows which medicines you are taking. Follow a special eating plan. Are active most days of the week. What are the basics about hemodialysis? Hemodialysis can replace part of your kidney function. In hemodialysis, your blood goes through a filter outside your body and filtered blood is returned to your body. Hemodialysis filters your blood to remove harmful wastes and extra fluid, helps control blood pressure, helps balance important minerals, such as potassium, sodium, and calcium in your blood. Hemodialysis isn't a cure for kidney failure, but it can help you feel better and live longer. You will also need to change what you eat, take medicines, and limit the amount of water and other liquids you drink and get from food. During hemodialysis, your blood is pumped through a filter outside your body. Before you can start hemodialysis, you'll need to have minor surgery to create a vascular access, a place on your body where you insert needles to allow your blood to flow from and return to your body during dialysis. You can have hemodialysis at a dialysis center or in your home. Hemodialysis is usually done at a dialysis center 3 times a week, with each session lasting about 4 hours. What are the pros and cons of in-center dialysis and home hemodialysis? Pros. Dialysis center. Dialysis centers are widely available in many parts of the country. Trained healthcare providers are with you at all times and help provide the treatment. You can get to know other people with kidney failure who also need hemodialysis. You don't have to have a trained partner or keep equipment in your home. Cons. Dialysis center. The center arranges treatments, so your schedule is less flexible. You must travel to the center for treatment. A longer time between treatments means you will have the strictest limits on diet and liquids, because wastes and extra fluid can build up in your body. Having too much fluid in your blood can raise blood pressure and stress your heart. Removing too much fluid too fast during standard hemodialysis also can stress the heart. You may have more ups and downs in how you feel from day to day because of the longer time between treatments. Feeling better after a treatment may take a few hours. Pros. Home hemodialysis. You gain a sense of control over your treatments. You can choose what time to have the treatment. However, you should follow your doctor's orders about how many times a week you need treatment. You don't have to travel to a dialysis center. The flexible schedule makes it easier to work outside the home. You can travel with a hemodialysis machine or arrange for in-center treatment at your destination. You'll have fewer ups and downs in how you feel from day to day because of more frequent treatments. You'll have fewer limits on diet and liquids because the shorter time between sessions prevents waste and extra fluid buildup. You can spend more time with loved ones and doing other things because you don't have to go to the dialysis center 3 times a week. Cons. Home hemodialysis. Not all dialysis centers offer home hemodialysis training and support. You and a family member or friend will have to set aside several weeks for training. Helping with treatments may be stressful for your treatment partner. You need space at home to store the hemodialysis machine and supplies. You'll need to learn to put dialysis needles into your vascular access. Medicare and private insurance companies may limit the number of home hemodialysis treatments they will pay for. Few people can afford the costs for additional treatments. What questions should I ask about hemodialysis? You may want to ask your healthcare provider these questions. Is hemodialysis the best treatment choice for me? Why? If I'm treated at a dialysis center, can I go to the center of my choice? What should I look for in a dialysis center? Will my kidney doctor see me at the dialysis center? What does hemodialysis feel like? How will hemodialysis affect my blood pressure, diabetes, other conditions? Is home hemodialysis available in my area? What type of training will I need? Who will train my partner and me? Will I be able to keep working? Can I have treatments at night? Will I be able to care for my children? How much should I exercise? Who do I contact if I have problems? Who will be on my healthcare team? How can the members of my healthcare team help me? If I do home hemodialysis, will my insurance pay for more than 3 sessions a week? Who can I talk with about finances, sex, or family concerns? Can I talk with someone who is on dialysis? What are the basics about peritoneal dialysis? You do peritoneal dialysis at home. Peritoneal dialysis uses the lining of your belly to filter wastes and extra fluid from your body. This lining, called the peritoneum, surrounds your abdominal cavity and replaces part of your kidney function. You can do peritoneal dialysis at home. You'll need to have minor surgery a few weeks before you start peritoneal dialysis. A doctor will place a soft tube, called a catheter, in your belly. The catheter stays in your belly permanently. When you start peritoneal dialysis, you'll empty a kind of salty water, called dialysis solution, from a plastic bag through the catheter into your belly. When the bag is empty, you can disconnect your catheter from the bag so you can move around and do your normal activities. While the dialysis solution is inside your belly, it soaks up wastes and extra fluid from your body. After a few hours, you drain the used dialysis solution through another tube into a drain bag. You can throw away the used dialysis solution, now filled with wastes and extra fluid, in a toilet or tub. Then you start over with a fresh bag of dialysis solution. The process of emptying the used dialysis solution and refilling your belly with fresh solution is called an exchange. You can choose which type of peritoneal dialysis will best fit your life. Continuous ambulatory peritoneal dialysis (CAPD). An exchange takes about 30 to 40 minutes, and most people need to do 4 exchanges per day. You sleep with solution in your belly at night. Automated peritoneal dialysis, which uses a machine called a cycler to do 3 to 5 exchanges per night while you sleep. You may have to do 1 exchange during the day without the machine. You may need a combination of CAPD and automated peritoneal dialysis if you weigh more than 175 pounds or if your peritoneum filters waste slowly. For example, some people use a cycler at night and perform 1 exchange during the day. Others do 4 exchanges during the day and use a mini-cycler to perform 1 or more exchanges during the night. You'll work with your healthcare team to find the best schedule for you. What are the pros and cons of CAPD and automated peritoneal dialysis? With either CAPD or automated peritoneal dialysis, you gain a sense of control over your treatments and don't need the help of a partner. After you're trained, you can do CAPD and automated peritoneal dialysis by yourself. With peritoneal dialysis, you'll have boxes of dialysis solution taking up space in your home. CAPD pros. You don't need a machine to do CAPD. You can do CAPD at the times you choose, as long as you complete the required number of exchanges each day. You can do CAPD in many locations. You can travel as long as you bring dialysis supplies with you or have them delivered to where you're going. CAPD cons. CAPD can disrupt your daily routine. CAPD is a continuous treatment, and you need to do all exchanges 7 days a week. Automated peritoneal dialysis pros. You can do exchanges at night while you sleep. You may not have to perform exchanges during the day. You can travel as long as you bring dialysis supplies with you or have them delivered to where you're going. Automated peritoneal dialysis cons. You need a machine. If you travel, you may have to carry your cycler with you. Your connection to the cycler limits your movement at night. What questions should I ask about peritoneal dialysis? You may want to ask your health care provider these questions. Is peritoneal dialysis the best treatment choice for me? Why? If yes, which type is best? What type of training do I need, and how long will it take? What does peritoneal dialysis feel like? How will peritoneal dialysis affect my blood pressure, diabetes, other conditions? Will I be able to keep working? Will I be able to care for my children? How much should I exercise? Where do I store supplies? How often do I see my doctor? Who will be on my healthcare team? How can the members of my healthcare team help me? Who do I contact if I have problems? Who can I talk with about finances, sex, or family concerns? Can I talk with someone who is on peritoneal dialysis? Does dialysis cure kidney failure? No. Even when very well done, dialysis only replaces part of your kidney function. Hemodialysis and peritoneal dialysis allow people with kidney failure to feel better and continue doing the things they enjoy, but neither replaces all of the jobs that healthy kidneys do. Over the years, kidney disease can cause other problems, such as heart disease, bone disease, arthritis, nerve damage, infertility, and malnutrition. These problems won't go away with dialysis, however, doctors now have new and better ways to prevent or treat them. You should discuss these problems and their treatments with your doctor. When do I have to start dialysis? For most people, the need for dialysis comes on slowly. Symptoms, such as losing your desire to eat and losing muscle, may begin so slowly that you don't notice them. Many people start dialysis when their kidney function, glomerular filtration rate, is between 5 and 10. When kidney function is this low, you may have symptoms from kidney failure, and starting dialysis may help relieve them. Starting dialysis can help you regain your appetite and maintain your strength, which is harder to rebuild than it is to retain. Your healthcare provider can help you decide the best time to begin treatment. What are the basics about kidney transplant? Kidney transplant is surgery to place a healthy donor kidney into your body. A working, transplanted kidney does a better job filtering wastes and keeping you healthy than dialysis, but it still isn't a cure. When you have a transplant, surgeons usually leave your old kidneys in place and connect the donated kidney to an artery and a vein in your groin. The surgeon also transplants the ureter from the donor to let urine flow from your new kidney into your bladder. The transplanted kidney takes over the job of filtering your blood. Your surgeon connects the transplanted kidney to your blood vessels in your bladder. Your blood flows through an artery into the transplanted kidney, and a vein takes filtered blood out. Your urine flows through a transplanted ureter to your bladder. Your body normally attacks anything it sees as foreign, so to keep your body from attacking the donor kidney, you will need to take immunosuppressants, also called anti-rejection medicines. Like all strong medicines, anti-rejection medicines have side effects. A transplant center can place you on the waiting list for a donor kidney if you have permanent kidney damage and your kidney function is 20 or less. While you're waiting for a kidney transplant, you may need to start dialysis. What are the pros and cons of a kidney transplant? Together, you and your transplant team should weigh the pros and cons of a kidney transplant. Pros. A transplanted kidney works like a healthy kidney. If you have a living donor, you can choose the time of your operation. You may feel healthier and have a better quality of life. You'll have fewer diet restrictions. You won't need dialysis. People who get a donated kidney have a greater chance of living a longer life than those who stay on dialysis. Cons. A kidney transplant requires surgery, which involves certain risks, such as infection. You'll go through extensive medical testing at the transplant clinic. You may need to wait years for a donor kidney. Your body may reject the donor kidney, so one transplant may not last a lifetime. You'll need to take anti-rejection medicines, which may cause other health problems, for as long as the transplanted kidney works. What questions should I ask about kidney transplant? You may want to ask your doctor these questions. Is transplantation the best treatment choice for me? Why? What are my chances of having a successful transplant? How do I find out whether a family member or friend can donate? What are the risks to a family member or friend who donates? If a family member or friend does not donate, who will place me on a waiting list for a kidney? How long will I have to wait? How will I know if my donor kidney is working? How long does a transplanted kidney last? What are the side effects of anti-rejection medicines? Who will be on my transplant team? How can the members of my transplant team help me? Who can I talk with about finances, sex, or family concerns? Can I talk with someone who is living with a kidney transplant? What are the basics about conservative management? Conservative management for kidney failure means that your healthcare team continues your care without dialysis or a kidney transplant. The focus of care is on your quality of life and symptom control. The decision to start dialysis is yours. For most people, dialysis may extend and improve quality of life. For others who have serious conditions in addition to kidney failure, dialysis may seem like a burden that only prolongs suffering. You have the right to decide how your kidney failure will be treated. You may want to speak with your family, doctor, counselor, or renal social worker, who helps people with kidney disease, to help you make this decision. If you decide not to begin dialysis treatments, you may live for a few weeks or for several months, depending on your health and your remaining kidney function. Many of the complications of kidney failure can be treated with medicines, but only dialysis or transplant can filter wastes from your blood. As your kidney function declines, you may want to consider adding hospice, or end-of-life care. You can have hospice care in a facility or at home. The hospice program is designed to meet end-of-life physical and emotional needs. Hospice care focuses on relieving pain and other symptoms. Whether or not you choose to use hospice, your doctor can give you medicines to make you more comfortable. Your doctor can also give you medicines to treat the problems of kidney failure, such as anemia or weak bones. You may restart dialysis treatment if you change your mind. What are the pros and cons of conservative management? The pros and cons of conservative management depend on your current health status. Weigh the pros and cons with the help of your doctor. What questions should I ask about conservative management? If you're thinking about conservative management, you may want to ask your doctor these questions. Is conservative management a treatment option for me to consider? Will dialysis improve my quality of life? Will dialysis prolong my life? Is there any downside to trying dialysis first? What should I do to prepare for conservative management? Who will continue to provide my care? Who will help my family? How long will I live? Will I be in pain? Can I stay at home? Where can I learn more about hospice? Who can I talk with about finances, advanced directives, sex, or family concerns? Can I eat the same foods with any kidney failure treatment? All of the treatment options for kidney failure require changes and limit what you may eat and drink. Hemodialysis. Hemodialysis has the most restrictions. You will need to watch how much water and other liquids you get from food and drinks. You will also need to avoid getting too much sodium, a part of salt, potassium, and phosphorus. You may find it difficult to limit phosphorus because many foods that are high in phosphorus also provide the protein you need. Hemodialysis can remove protein from your body, so you will need to eat foods with high-quality protein such as meat, fish, and eggs. Avoiding foods such as beans, peas, nuts, tea, and colas will help you limit your phosphorus. You may also need to take a pill called a phosphate binder with your meals. Phosphate binders keep phosphorus in your food from entering your bloodstream. Talk with your dialysis center's dietitian to find a hemodialysis meal plan that works for you. Peritoneal dialysis. Like hemodialysis, peritoneal dialysis requires limits on sodium and phosphorus. You may need to take a phosphate binder. The liquid limitations in peritoneal dialysis may not be as strict as those for hemodialysis. In fact, you may need to drink more water and other liquids if your peritoneal dialysis treatments remove too much fluid from your body. Peritoneal dialysis removes potassium from the body, so you may need to eat potassium-rich foods such as potatoes, tomatoes, oranges, and bananas. However, you'll have to be careful not to eat too much potassium because it can cause an unsteady heartbeat. Peritoneal dialysis removes even more protein than hemodialysis, so eating foods with high-quality protein will be important. You may need to limit calories because your body will absorb sugar from the dialysis solution. Kidney transplantation. Kidney transplantation has the fewest restrictions on your diet. You will need to limit sodium because it can raise your blood pressure. Medicines that you take after the transplant can cause you to gain weight, so you may need to limit calories. Conservative management. The diet for conservative management limits protein. Protein breaks down into waste products the kidneys must remove. Limiting protein may reduce the amount of work the kidneys have to do so they will last longer. How can I decide which treatment is right for me? Choosing the kidney failure treatment that is best for you may be hard. To make it easier, start learning about your treatment options early. Think about how each treatment will affect your daily routine and how you feel. Talk with your doctor and with people who are on hemodialysis or peritoneal dialysis, or who've had a transplant, to find out the pros and cons of each treatment. Find out how the treatment changed their lives and the lives of those closest to them. Ask your doctor about the transplant waiting list, and about diet changes and medicines you'll need with each treatment. If you're thinking about conservative management, ask your doctor how you'll feel and how treatment can help keep you comfortable. Reflect on what's most important to you. If you plan to keep working, think about which treatment can make that easier. If spending time with family and friends means a lot to you, ask which treatment would give you the most free time. Find out which treatment would give you the best chance of feeling good and living longer. You may wish to speak with your family, friends, healthcare team, spiritual advisor, or mental health counselor as you decide. Can I stop or change my treatment once I start? Yes, you can change your mind. If you don't like your treatment choice, talk with your healthcare provider about trying something else. How can I learn what I should eat? Your dialysis center has a renal dietitian to help you plan your meals. A renal dietitian has special training in caring for the food and nutrition needs of people with kidney disease. Use this information to help you learn how to eat right to feel right on hemodialysis.
Peritoneal dialysis. What is peritoneal dialysis and how does it work?
Peritoneal dialysis is a treatment for kidney failure that uses the lining of your abdomen, or belly, to filter your blood inside your body. Healthcare providers call this lining the peritoneum. A few weeks before you start peritoneal dialysis, a surgeon places a soft tube, called a catheter, in your belly. When you start treatment, dialysis solution, water with salt and other additives, flows from a bag through the catheter into your belly. When the bag is empty, you disconnect it and place a cap on your catheter so you can move around and do your normal activities. While the dialysis solution is inside your belly, it absorbs wastes and extra fluid from your body. Peritoneal dialysis. After a few hours, the solution and the wastes are drained out of your belly into the empty bag. You can throw away the used solution in a toilet or tub. Then, you start over with a fresh bag of dialysis solution. When the solution is fresh, it absorbs wastes quickly. As time passes, filtering slows. For this reason, you need to repeat the process of emptying the used solution and refilling your belly with fresh solution 4 to 6 times every day. This process is called an exchange. You can do your exchanges during the day, or at night using a machine that pumps the fluid in and out. For the best results, it is important that you perform all of your exchanges as prescribed. Dialysis can help you feel better and live longer, but it is not a cure for kidney failure. How will I feel when the dialysis solution is inside my belly? You may feel the same as usual, or you may feel full or bloated. Your belly may enlarge a little. Some people need a larger size of clothing. You shouldn't feel any pain. Most people look and feel normal despite a belly full of solution.
What are the types of peritoneal dialysis? You can choose the type of peritoneal dialysis that best fits your life: continuous ambulatory peritoneal dialysis (CAPD), automated peritoneal dialysis. The main differences between the two types of peritoneal dialysis are the schedule of exchanges. One uses a machine and the other is done by hand. If one type of peritoneal dialysis doesn't suit you, talk with your doctor about trying the other type.
CAPD doesn't use a machine. You do the exchanges during the day by hand. You can do exchanges by hand in any clean, well-lit place. Each exchange takes about 30 to 40 minutes. During an exchange, you can read, talk, watch television, or sleep. With CAPD, you keep the solution in your belly for 4 to 6 hours or more. The time that the dialysis solution is in your belly is called the dwell time. Usually, you change the solution at least 4 times a day and sleep with solution in your belly at night. You do not have to wake up at night to do an exchange. Automated peritoneal dialysis. A machine does the exchanges while you sleep. With automated peritoneal dialysis, a machine called a cycler fills and empties your belly 3 to 5 times during the night. In the morning, you begin the day with fresh solution in your belly. You may leave this solution in your belly all day or do one exchange in the middle of the afternoon without the machine. People sometimes call this treatment continuous cycler assisted peritoneal dialysis or CCPD. Where can I do peritoneal dialysis? You can do both CAPD and automated peritoneal dialysis in any clean, private place, including at home, at work, or when traveling. Before you travel, you can have the manufacturer ship the supplies to where you're going so they'll be there when you get there. If you use automated peritoneal dialysis, you'll have to carry your machine with you or plan to do exchanges by hand while you're away from home. How do I prepare for peritoneal dialysis?
Surgery to put in your catheter. Before your first treatment, you will have surgery to place a catheter into your belly. Planning your catheter placement at least 3 weeks before your first exchange can improve treatment success. Although you can use the catheter for dialysis as soon as it's in place, the catheter tends to work better when you have 10 to 20 days to heal before starting a full schedule of exchanges. Your surgeon will make a small cut, often below and a little to the side of your belly button, and then guide the catheter through the slit into your peritoneal cavity. You'll receive general or local anesthesia, and you may need to stay overnight in the hospital. However, most people can go home after the procedure. You'll learn to care for the skin around the catheter, called the exit site, as part of your dialysis training.
Dialysis training. After training, most people can perform both types of peritoneal dialysis on their own. You'll work with a dialysis nurse for 1 to 2 weeks to learn how to do exchanges and avoid infections. Most people bring a family member or friend to training. With a trained friend or family member, you'll be prepared in case you have a sick day and need help with exchanges. If you choose automated peritoneal dialysis, you'll learn how to prepare the cycler, connect the bags of dialysis solution, place the drain tube. If you choose automated peritoneal dialysis, you also need to learn how to do exchanges by hand in case of a power failure or if you need an exchange during the day in addition to nighttime automated peritoneal dialysis. How do I perform an exchange? You'll need the following supplies: transfer set, dialysis solution, supplies to keep your exit site clean. If you choose automated peritoneal dialysis, you'll need a cycler. Your healthcare team will provide everything you need to begin peritoneal dialysis and help you arrange to have supplies such as dialysis solution and surgical masks delivered to your home, usually once a month. Careful hand washing before and wearing a surgical mask over your nose and mouth while you connect your catheter to the transfer set can help prevent infection. Use a transfer set to connect your catheter to the dialysis solution. A transfer set is tubing that you use to connect your catheter to the bag of dialysis solution. When you first get your catheter, the section of tube that sticks out from your skin will have a secure cap on the end to prevent infection. A connector under the cap will attach to any type of transfer set. You connect your catheter to the transfer set to do your exchange. Between exchanges, you can keep your catheter and transfer set hidden inside your clothing. At the beginning of an exchange, you'll remove the disposable cap from the transfer set and connect the set to a tube that branches like the letter Y. One branch of the Y tube connects to the drain bag, while the other connects to the bag of fresh dialysis solution. Use dialysis solution as prescribed. Dialysis solution comes in 1.5 to 2.5 or 3-liter bags. Solutions contain a sugar called dextrose or a compound called icodextrin and minerals to pull the wastes and extra fluid from your blood into your belly. Different solutions have different strengths of dextrose or icodextrin. Your doctor will prescribe a formula that fits your needs. You'll need a clean space to store your bags of solution and other supplies. Doing an exchange by hand. After you wash your hands and put on your surgical mask, drain the used dialysis solution from your belly into the drain bag. Near the end of the drain, you may feel a mild tugging sensation that tells you most of the fluid is gone. Close the transfer set. Warm each bag of solution to body temperature before use. You can use an electric blanket, or let the bag sit in a tub of warm water. Most solution bags come in a protective outer wrapper, and you can warm them in a microwave. Don't microwave a bag of solution after you have removed it from its wrapper. Hang the new bag of solution on a pole and connect it to the tubing. Remove air from the tubes. Allow a small amount of fresh, warm solution to flow directly from the new bag of solution into the drain bag. Clamp the tube that goes to the drain bag. Open or reconnect the transfer set, and refill your belly with fresh dialysis solution from the hanging bag. Using a cycler for automated peritoneal dialysis exchanges. In automated peritoneal dialysis, you use a machine called a cycler to fill and drain your belly. You can program the cycler to give you different amounts of dialysis solution at different times. Each evening, you set up the machine to do 3 to 5 exchanges for you. You connect 3 to 5 bags of dialysis solution to tubing that goes into the cycler, 1 bag of solution for each exchange. The machine may have a special tube to connect the bag for the last exchange of the night. At the times you set, the cycler releases a clamp and allows used solution to drain out of your belly into the drain line. Warms the fresh dialysis solution before it enters your body. Releases a clamp to allow body temperature solution to flow into your belly. A fluid meter in the cycler measures and records how much solution the cycler removes. Some cyclers compare the amount that was put in with the amount that drains out. This feature lets you and your doctor know if the treatment is removing enough fluid from your body. Some cyclers allow you to use a long drain line that drains directly into your toilet or bathtub. Others have a disposal container.
How will I know if my peritoneal dialysis is working?
To find out if your dialysis exchanges are removing enough wastes, you'll have a blood test and collect used dialysis solution once a month. If you're still urinating, you may need to collect urine. These tests help your doctor prescribe a dialysis schedule and dose to meet your health needs. If your dialysis schedule isn't removing enough wastes or your body is absorbing too much dextrose, your doctor will make adjustments. Read about peritoneal dialysis dose and adequacy.